Complete and incomplete choking. Complete choking means complete cessation of the airway. It happens mostly in children. The children, if a child can take a radium ball, a child can engulf a fish like a battery, lead battery, anything. So in such a manner, what happens? There will be a complete cessation of the airway. In adults, incomplete choking. How? Most common is fish balls. They eat and they talk, most of us. That is the reason our elders tell, do not talk when you eat, just to prevent choking. Second thing is spreading of aerosols, which we learned more extensively during COVID. When we talk more and when we eat, the aerosols will be exchanged between the plates. These two things, that is the reason we should not. But to avoid incomplete choking, we need to avoid like fish. We need to stop talking when we eat, when we chew, or else it can get inside and lodge into the upper airway. Never a fish bone goes in deeper, but it can obstruct so that it will be removed with a retrograde bronchoscopy. So this is universal sign of choking. Even if there is a small foreign, even if we get tonsillitis also, we feel like catching like this. And we feel something gets relieved. So this is a universal sign of choking. And if the patient has a complete choking, the patient will be having universal sign of choking followed by cyanosis, central cyanosis. The patient would be having a color change on the face. Why? Lack of oxygen. Slowly, first the breathing stops, and then if nothing being done, circulation will be stopped. B stops, C stops. If C stops, B stops. Both are correlated. So this is Heimlich maneuver in responsive attention. If any child or any person is choking and responsive, then we need to do Heimlich maneuver. So Heimlich maneuver means Heimlich maneuver means we'll be putting, we'll be making a fist of our dominant hand. We'll be putting on the abdomen at the epigastric area. Let me consider this as the epigastric area, and then we will be stabilizing with the other hand, and we'll be giving a intra-abdominal pressure. Give intra-abdominal pressure like this, towards the upwards, backwards and upwards. 1, 2, 3, 4, 5. If you give 5 times, the intra-abdominal pressure and the intrathoracic pressure will be exerted so that a complete a ball or lead battery will be thrown out. If it is not thrown out, then we will go for an advanced mode. And if the same thing happens in a baby, how do we do? If the same thing happens in a baby, how we do? We need to put the baby on our lap and make sure that something is like underneath our lap, because if the baby accidentally falls, the baby does not have any injury. And you just come. You need to do two finger only here. 3, 4, 5. You need to do 5 times. 5 times front chest compressions followed by 5 times backward blows like this. 1, 2, 3, 4, 5. If you do 5 is to 5, automatically the baby might be throwing. If the same baby or a person becomes unresponsive, what do you need to do? When we are doing this, we are doing the Heimlich maneuver. If this baby or the adult becomes unresponsive, what will be doing? We'll check for pulse. Again, we'll go for the BLS. If the pulse is there and the patient is partially breathing, then what you need to do? Open the mouth and look for foreign body. If the foreign body is visible, try to remove it with a forceps. Do not manipulate with the hand. Why? The foreign body can go inside. So please make sure when the foreign body is there, either with an aspirator, you'll be having the aspiration tongue, right? Either with aspiration or with a mosquito forceps or with a mosquito. Just please remove it. Please do not manipulate with the finger. It can dislodge back. If it goes into esophagus, no one will bother. If it goes into trachea, only the problem comes. So this is the 5 back blows. How we do? And we need to put the baby on the lap. Why? It will be easy for us. It will be easy for us to give front and back. This is the chest thrust. 5 chest thrusts and 5 back blows need to be given. How about in obese and pregnant ladies? In obese and pregnant ladies, you cannot do on the stomach because there won't be any intra-abdominal pressure exerted. In pregnant ladies, it will be harming the patient. So what we need to do? So there is no abdominal thrust. So what we need to do? We have to put on a epigastric area or zipisternal area. In the zipisternal area, we will be giving the chest comparator, intra-abdominal pressure. So she is having choking, she is eating something, she was talking to someone, and she suddenly had a choking. So see, this is the typical choking sign, universal choking sign. So if there is a universal, this is a typical universal choking sign where you could see. So what they do? Step one, ask if they are choking or not, and then she tries to give the back blows in the choking. And then she goes to the Heimlich maneuver. She does 5 back blows. See how she is doing the back blows. This back blow is completely different to the back blows what we do in the babies. In the babies, we put on the lap and we give the back blow. But this is different. There are chances that with this back blow also, foreign body can come out. Or the foreign body can be come onto the tongue. And this is a Heimlich maneuver. You need to put our leg in between the patient, 2 legs, so that we can stabilize the patient when we hold the patient. You make a flat fist with your one of your hand and you give C. That's the Heimlich maneuver. So the entire abdominal pressure gets, see how the foreign body has come up. So when the foreign body comes out, you have to make sure that auscultate the patient.
Can you show one demo?
Yes, sir. Sure, definitely. So, yes, correct. After this, I'll show you. So, the seek a medical attention if needed, especially in the hospitals when any foreign body happens. After the removal of the foreign body, please ask for 2 things. One is for X-ray. Second is auscultate the patient. Because therefore, if the foreign body has some kind of particles, the particles might have dislodged into the alveolar level, not alveolar level, in the bronchial level, primary and secondary bronchial. So at that point of time, the patient might start having these. So even if the foreign body comes out, the patient might be having breathlessness. That is because of bronchoconstriction. So you need to check, auscultate the patient. And then what you need to do? Get an X-ray. So that if there are any other remnant foreign bodies are there, please call your pulmonologist and go for a bath, bronchoalveolar lavage. Okay? So he is a person who talks a lot when he eats. So let us assume that he started having choking. So let us assume that he is choking. So he is able to choke, and this is a universal choking sign. And when this universal choking sign comes, automatically he approaches to the nearest medical center and is an ER technician. So no doctor is available in the night. So what he does is he, as a patient is stable, stable in the sense patient is conscious, and when he walks in, automatically he is able to breathe and he is having pulse. There is no need to check pulse for this kind of patient. So what he does, he asks that he stabilizes the patient and he comes back and he does the Heimlich maneuver. First he starts with the back blows. See how he gives the back blows. We need to give it force. I do not want to harm him, that's why. So he has given 5 back blows. We don't know what this fellow has consumed, so nothing has come out. So now the emergency technician will be giving Heimlich maneuver. So see, he is doing with a fist.
Come in front, sir.
Hey, you
Both
come
of you
here.
come in front, sir. Sir, show your photo.
Go in the middle. Go near the middle. అలాగే ఛాన్స్ ముందుకెళ్ళి ఇంకా ముందుకెళ్ళి ఇంకా yes. So let us see. So he is making a fist with his left hand, and then he is stabilizing with the right hand. He is putting one of his leg between the patient's two legs. Okay, leg bit. Yes. And then this is the way. And now he is doing the Heimlich manual. He will be giving 5. 1, 2, 3, 4, and 5. That is as if that the foreign body has come out. And please don't ask me repeat this fellow. They both will quarrel. So this is the how you do the Heimlich manual. So this is one of my favorite cartoon. I wish to share. That's a cyanotic change. Is a BLS provider like you? So this is AED. So this is the AED, automated external defibrillator. So an AED has basically three things. One is AED and a power supply and the pads. These are the pads. These are the adhesive pads. There will be two adhesive pads. One you need to pour paste on the right shoulder. The other you need to paste on the left inferior, left side of left lateral side of the lower part of the chest. I'll say maybe infra-axillary. Left infra-axillary near fourth and fifth intercostal space. Left lateral in the mid-axillary line. Okay. So this AED means automated external defibrillator. Why automated? External defibrillator, you know. Internal defibrillator, cardiologists know. Why automated? Because it gives the shock automatically. It doesn't. There's no need for us to put the paddles, everything, and no need to check for the rhythm. This is for basic life support. For advanced life support, automatically we'll be using the defibrillator. But for basic life support means this is to get an idea and to operate so that the patient, we need to reduce the chances of the patient getting died. Advanced means definitely we won't let the patient die. So in automated external defibrillator, see what it does. It detects the heart rhythm. It automatically advises whether shock is there or not. It delivers the shock with a push button, and it converts the heart rhythm back to normal. So it converts the heart rhythm back to normal. How does it convert the heart rhythm back to normal? When there is a rhythm, VF or VT, ventricular fibrillation or ventricular tachycardia, automatically, that is not there in BLS. I'm just telling because you are fellow medical colleagues. So when there is a VF or VT, the heart rhythm is very abnormal and very uncontrollable. In VF, there won't be any heart rate recorded. In VT, definitely the heart rate recorded more than 200 times. I'm not talking about SVT, I'm talking about a VT. So SVT is completely different. So VT or SVT, let us consider VF or VT. We need to reset the heart rhythm. Once we reset the heart rhythm only, we will be able to make sure that the heart rhythm pumps back in a normal way. The heart continuously flickers in 200 per minute. The heart will lose its control, and there will be a chances of cardiac rupture or cardiac infarction. There will be more hypoxic state to the heart. How to use an AED? So these are the things. We need to power on, we need to attach the pads, we need to allow and analyze the rhythm, and we need to push the shock button. Next. Remove clothing and dry the patient. If the patient is drowning, please do not stick the AED. If the patient is having too much sweat, please do not stick the AED. Please clean it with the patient's cloth or with some available gauze pad or anything. Why? Electricity, right? AED. So let us not involve any kind of fluids in this. And what if hair is there and if you give a shock, the hair gets burnt. so that the shock doesn't go inside. And there will be a charring on the skin. The skin also might go into first degree burns. So these are the pads. The pads will be either on the AED or this adjacent to the AED. So remove the adjacent, stick to the pads. And what if the patient is having too much hair? What do we do? I told we need to minimize the compressions time interruptions. How do we remove the hair within 10 seconds? Don't say all those creams, sir. Don't talk about hair removal creams. Again, you need to put intent of hair removal creams in ICU and ER. How do we do? For any person, for any AED, there will be two sets of pads. So apply first set of pads, remove it. The hair also will come. Throw it, and then place the second set of pads. No, that's what we do. We don't wait for the shaver, we don't wait for the trimmer, we don't wait for the housekeeping to do all those. I place the first pad, I remove it, and then I place the second pad. There are 3 to 5 instances where we will need it also. This is a practical thing. It won't be written in the books. This is a practical thing. So don't wait for the shaving cream, don't wait for the shaving foam, don't wait for all these other instructions also. Placement of AED pads. See here, this will be in the left lateral part of the chest, and one more will be in the right shoulder, anterior aspect of the right shoulder. Make sure that pads are plugged into AED. When the pads are plugged into AED, automatically the circuit gets closed. The one on the shoulder is the positive terminal. The one left lower part of the chest is a negative terminal. When you include the both, then the circuit gets closed. If the circuit gets closed, then we can it automatically analyzes the rhythm and it will say whether shock has to be given or not. Prior to pressing the shock button, here we do the all clear. Everyone should be clear and we need to give shock. Immediately after giving the shock, if the pulse has come or not, the AED will tell please resume CPR. So automated external defibrillator, the main advantage is it gives instructions. It tells us everything. Next. So how an AED works, this is the last slide. So why I'm using this is from Action First Aid Canada, Ontario. I'm one of the member in their Action First Aid Ontario members, so like a committee. So I'm an instructor in Canada also. I used to be instructor, not now. I used to be instructor in Canada, especially in the South Canada. So that's the reason I got these videos from them. So this is a AED. You could see this is a positive terminal, that is a negative terminal, and you could see this is the heart flickering. See, this is the VF. VF means irregularly irregular. So this is the EF. If this like this is there, see, if the heart flickers, there is no blood supply happening. What do you need to do? Even if you give compressions also, it won't work out perfectly. Then AED needs to be given. See, at one point of time, we press the shock. See, the AED pads are being attached. Shock has. Now they will press the shock. One more indication of AED. And the shock has been pressed. See, automatically the heart rhythm has got resetted. And again, at this point of time, either the heart completely stops, where we need to resume the CPR, or the heart starts back to normal. So again, the pacemaker starts distributing. Let's say node AB node started distributing perfectly. And the entire thing should be happening less than 30 seconds. Of course, the AED will be telling everything immediately. So this is the glossary, what we have discussed till now. So adults, children and infants. The only difference what we have here is two things. Activating emergency response system. Activating emergency response system, it should be either for a witnessed collapse or unwitnessed collapse. Witnessed collapse follow steps for adult and adolescents. Witnessed collapse means the baby collapse in front of us. If the baby is unwitnessed, if we go and see suddenly the baby is unresponsive, first start CPR. Give, give a set of CPR, means 5 cycles of CPR that is to do, and then call to the courtroom. Why? If you call, there will be much more delay. First you give some CPR and oxygen 2 breaths, then you call, immediately the baby can have some kind of circulation, and we don't know when the baby has become unresponsive, but this will be helpful indirectly. And one more difference is 30:2. Single or double rescue 30:2 in adults, but in children when it is coming, one rescuer is 30:2, 2 or more rescuers 15:2. So do CPR if a patient is unconscious, no B and no C. Chest compressions are the most important part. Emphasis on chest compressions, push hard, push fast, and push rhythmic. Don't stop pushing. Remember the slight differences between the infants and children, like the depth. In infants it is 4 centimeters. In children it is 5 centimeters. Aim for early defibrillation. Early defibrillation means early attack. If aid is available, please attach it. We do not know what is happening inside. Thank you very much.